Good afternoon, all. Uh, we'll start today's class. Okay. So, the PPT was taught to you, right? See, this needs to be a practical class. So, uh, it will be great if you'll respond because we'll be taking practical aspects of Nadi Pariksha today. CH Karunanidhi, I will like you to have your mic on and, if possible, your video also on, so that we can easily learn the practical things for Nadi Pariksha today. Okay. So while I am teaching, I'll be telling you how to hold a Nadi, how to feel it. For that, you need to see me and I need to see and check if you are holding the things right or if you are seeing the Nadi right or not. CH Karnanidhi, please can you yeah, turn your mic on or say something so that I know you are listening to me. Okay, so I need you to keep your mic off but your camera on so that while I'm teaching, we both can see each other. Okay, so till then, you have completed your this PPT, right? Which I'm showing on the screen right now.
Okay, ma'am.
The PPT which I'm sharing on the screen right now. Have you completed this? Like you have completed the PPT, right, in the previous classes?
Yes, ma'am. Completed, ma'am.
Okay, so basics are done. Okay, so from today we'll start the practical aspect.
Okay.
So, do you know there are different kinds of nadis?
3 types of nadis, ma'am. Vata, Pitta, Kapha.
Vata, Pitta, and Kapha. Okay. So one more thing. Are you comfortable in English or are you comfortable in Hindi as well?
English, ma'am. English only, ma'am. Hindi don't know, ma'am.
English. Okay, ठीक है, okay, no problem. See, so first of all, we'll start with nadis. So basic three doshas are there. Okay, Vata, Pitta, and Kapha. So each of the fingers, with which we check the nadi, indicates one of the doshas. ठीक है. So first index finger denotes Vata dosha. Uh, Middle finger denotes Pitta dosha, and the ring finger denotes the Kapha dosha. Okay.
Okay.
So there is a way to hold the finger. You start your camera so that I can see you, and you show me how do you hold a nadi while checking it. What is the direction that you hold the nadi in? 1 second. I have to stop sharing. Okay. Yeah. So how do you hold a nadi while checking it?
Video is not. Oh, okay, ma'am. Yes, sir.
Huh. Okay. So you know there are three Vata dosha and Vata, Pitta, and Kapha dosha in each of the finger. Okay.
Okay.
So when you check, so because we are doing it one on one and you do not have anybody else to check nadi for, so we'll see it on ourselves only. So first of all, when you check it on yourself, what you have to do is take your left hand and like this you have to hold the nadi. So
Okay.
not like this. You cannot check your nadi like this. That is the wrong method. Okay, because the finger adjustment will go wrong. This is Vata,
Okay.
this is Pitta, this is Kapha. It should come. This index finger should come towards the thumb.
Okay.
Yeah. So your left hand, you can just go. You keep your left hand normally in front of you, and go with the right hand. You can go beneath it and hold your nadi like this. Okay. So
Like
you have
that?
to keep this hand, you have to keep this hand very gently, very calm, and full. All the weight of this hand should go on your other hand. So while holding it, your this left hand's weight should go on right hand's palm, and your three finger, index finger, middle finger, and ring finger should be holding the nadi. Okay. And how much distance it should be? So it should not be immediately, like this is the thumb, so it should not be immediately here. So
Okay.
while holding it, first you do this.
Okay.
Okay. So this much distance you should leave, and after leaving this much distance, then you should hold the nadi. So there should be one finger cut distance between the thumb and the first finger you keep on the nadi. Show me.
Okay.
Yes. So there should be a distance which you should leave between the index finger and the thumb, base of the thumb. Okay, that is the correct way. So when you hold for yourself, you hold like this, but when you go and check it for somebody else, so somebody else, you will go like this, because their hand will be like this, so your hand should be like this. Okay,
Okay.
like this. So if there is someone else's hand, then you will go like this, not from the under the hand, you will go from up. This is the way. And there are different kinds of nadi. So different kind of nadi means, first of all, there in our whole body there are different parts where we can feel nadi. Okay, so generally we check on radial artery, this thumb region, because this is the most prominent one. And I will tell you where all other parts we can check nadi and what it signifies. So first of all, we'll go from up. So this is Shankh-nadi. Shankh-nadi is the temporal artery. Okay. So temporal artery is the Shankh-nadi. When we feel this temporal artery, with this we can find out if the person has headache, cerebral pathology, yeah, whatever related to head. Okay. We'll discuss that later on. That is not very commonly practiced also, but that is the basic thing, that everywhere in the body where arteries are present, we can check the nadi. Then second is Jatru artery. Jatru artery is this carotid artery. So whenever a person falls unconscious, immediately our response is we'll check for the pulse here. So this is also one nadi. This is Jatru nadi. Okay, carotid artery pe. So with here when we check nadi, we check it for thyroid glands or thyroid disorders, hypothyroidism, okay, goiter and all those things. Then third one is Purpara Nadi. Purpara Nadi is the brachial plexus here. Okay, so there is one Nadi here also. You feel it in the brachial plexus. So this Nadi, what it tells? It tells about the pancreatic disorders, diabetes mellitus. Okay, this is the brachial artery. Then comes our radial artery, which we usually check. This one. So this is Manibandha Nadi. Okay, Manibandha Nadi. With this artery, what we specifically check? We check Prakriti of a person, Vikriti of a person. Prakriti, Vikriti, you know, right?
No, ma'am, I know.
हाँ, so prakriti of a person, vikriti of a person, dhatu, ojas, tejas, pran, everything we check it from here. That's
Of
why
course.
when we do a nadi pariksha, we prefer this artery, because it tells us about the first of all, it tells us about the prakriti of a person. Then it tells us about the vikriti of a person. So we can relate that this, if this person's prakriti is predominantly vata, but right now its nadi is showing kapha features, or it is very madhya, or its gati is low, all those things we can see. Then then we'll come to know that this person's basic nature, basic prakriti is vata, but it is showing more of the kapha feature. That means that comes under vikriti.
Okay.
Okay, so that is not the prakritavastha. Then it comes to nabhi nadi. Nabhi means umbilical region. So when we check for umbilicals, so have you ever heard that there is this thing called shifting of nabhi? Okay,
Ma'am.
so okay, I'll tell you. So there are the different practices in which people actually adjust nabhi. Okay, so nabhi, what happens is sometimes when person lifts weight, or when person is not his stomach is not fine, or his digestive system has some issues. When you check for nabhi is slightly shifted. Either it is shifted towards right or left or up or down, but it is shifted. So there is a practice called nabhi adjustment. Nabhi adjustment may, what they do is they adjust. There's few exercises, and then there's a few pattern is there, like few steps are there, that is performed over the patient to adjust the nadi and bring it back to the normal position, so that
Okay.
whatever difficulty is caused along with the nadi, like surrounding the nadi in the stomach, that everything goes away. So for that nabhi nadi, that nabhi nadi is also checked. Okay, so if nabhi, when you check for nabhi nadi and you find that nabhi nadi is gone up, that it has moved up, it signifies that patient might be suffering with gastritis.
Okay.
You know what gastritis is, right?
And
He'll have sour belching, burning sensation of the chest, indigestion, and all those things. So when you check for nabhi nadi, and if you find that nabhi is shifted upwards, so it should be here. this is the place of Nabhi, and it has shifted upwards. That means the person is might be suffering with gastritis and stuff. Okay, and if Nabhi has shifted little bit down, that means it could be colitis. Okay,
Colitis.
mainly related to intestine, that to large intestine difficulty. Okay, then if it has shifted to slightly right part, so that will mean it has pitta disorders, pitta or regional ileitis, like that. Okay, so and when it has shifted to left, that means it could be related to liver. The difficulty, it could be related to liver and stuff. Okay, so this is also one way of checking Nabhi Nadi. Then comes femoral artery. Okay, in leg, thigh region, there is one femoral artery which is called Vankshana Nadi. That is also checked. Then Janu Nadi is there. Janu Nadi is just behind the knee. Behind the knee we have a gap, right? So when you touch there, you will feel a beating, a pulse you will feel. Okay, so that Janu Nadi, when we check it, we could find Baker's cyst, rheumatoid arthritis or osteoarthritis, tubercular arthritis, all those features. Okay, then comes the Gulfanadi. Gulfanadi is tibial artery. So, have you ever seen that when a surgeon or osteopathic surgeon, bone surgeon, when he does surgery, immediately after surgery, what he checks is the tibial area. Tibial area, he checks for pulse. If he does not get pulse, matlab, he'll be very anxious till he gets the pulse. He will be very agitated that he's not got the pulse. So that pulse is very important. In Ayurveda also, Gulfanadi is very important. When we check Gulfanadi, we can tell about the kidney diseases.
Okay, okay.
Okay, so tibial pulse, when we check, it immediately tells us about the kidney related stuff, all the kidney related stuff. Okay, then Padanadi. Padanadi is dorsal pedialis. Okay, above the leg, when we check, that is, so it tells us about DVT, thrombophlebitis, or varicose vein. Varicose vein is very common nowadays. Every third person comes to OPD with varicose vein.
Right.
Then Kanishtika. So there are total 10. 9 I have told. One is Kanishtika. Kanishtika is a little finger nadi. So inside, when you take your right hand and inside that, sorry, left hand and inside that,
Okay.
inside that, you feel a very, if you feel a very prominent beating, which is not possible in males because this signifies pregnancy.
Only pregnancy, ma'am.
Only pregnancy. So when you find a prominent beating, matlab little bit of beating you can find, that is very common because arteries are everywhere. But if you find a very prominent beating here, that means the lady could be pregnant.
Yes.
Okay, and there is different levels of it. You can when you get to a certain experienced level in nadi, then you could count the beats and tell the gestational age also, that it is 3 weeks pregnant or 4 week pregnant or 5 week pregnant. That is the great nadi vaidyas. They do not need anything else, just the nadi to tell everything. And
Left side
you can
male. Left
what
side female. Left side female. And in the right side male. Some
male,
persons is
yeah. That is there. So we'll discuss this later on. When you take and the reason also I'll tell you later. But for female, when you check, you should take left hand, and for male, you should take right hand.
yes.
There are different practices. Different people practice differently, but this is what I have been taught by my guru, and we practice it like that. So maximum people, for 80% of the Nadi Vaidyas, practice it like that only. So right for the male and left for the female. So this is about the different nadis. Okay,
Yes.
now we'll go on to physics of pulses. So there's different methods like vega, tal, that is rhythm, rate, volume, density, and everything. Okay, so one by one we'll see that, and then we'll try practicing on ourselves because we do not have anybody else to practice on. So we'll hold our pulse and do it. So I want you to take a watch, hand watch or something which has second ka,
Yes.
which shows seconds. Yeah. So keep it with you right now, because
Okay,
then
fine.
we'll count it for 1 minute, right?
Okay.
So you've kept the watch with you.
No, ma'am. Still stopwatch I have, ma'am.
Stopwatch, huh? That is also fine. No problem. I just want 1 minute so that exactly 1 minute that can show that 1 minute is over. That's all. You can keep mobile phone, watch, or anything you want.
Okay, ma'am.
Okay. So now we'll see physics of pulse. Okay. Physics of pulse में first thing we'll see is Nadi Veg. Nadi
Okay.
Vega. Nadi Vega is rate of the Nadi. So can you tell me what is rate? Like what do you understand by weight of the Nadi? Okay. So it is number of beats per minute. So when you hold your hand, when you hold your Nadi, so you feel a uplift, you feel a beat, tuck, tuck, tuck,
Okay.
tuck, like that. So we'll have to count this beat within a span of 1 minute. So how
Okay.
many beats, how many times the nadi is beating in 1 minute? That is called rate. Okay.
Total, ma'am, or single fingers are only. What with
No, no,
kapha?
you keep all the three fingers and you will
Okay.
feel, but wherever you feel, we'll not see which finger it is feeling. We'll just count the number of beats, how many beats it is feeling. Okay. So
That means
you will start the timing,
okay. I
and
will
for
start.
1 minute we both will count, and then you tell me how many beats you found out.
89 per minute, ma'am.
89 per
89.
minute. ठीक है. Okay. Okay. Now keep that in mind. Note it somewhere. Keep it that we found out 89 beats per minute. Now I'll tell you. Uh, it's what when should we count this pulse? Okay. So when we count this pulse, it could be, for some people it could be 50, it could be 80, it could be 90, 95. It varies. Okay. So if you run for some few minutes and then you come and sit, your rate will increase. So it is affected by a lot of factors. The person have had food, if he has had water, or he's anxious, or he's stressed, or he's walking, running, everything is depends on. So when we sit in a OPD, how we will practice is, first when patient comes, you need, before checking the nadi, because every time you check a nadi you need a resting pulse. Okay. So it should not be affected by any of the external factors, like he came running and he just now came to OPD and directly he sat in front of you. His pulse rate will, his rate will be up and down, obviously. So every time you need to check for a resting pulse. Okay. So what you can do is, you can ask the patient to wait for a few minutes, sit, relax, have a glass of water, and then come in the OPD to for a nadi pariksha done. And mostly what we practice is, if it is not an emergency, all the nadi patients you can call in the morning, empty stomach.
Okay.
Okay, so it should be checked empty stomach in the morning, and that too within a span of 6:30 to 9 o'clock. Because if a person wakes up at 6 o'clock and if he's coming to you at 10 o'clock empty stomach, that will also affect his nadi, because his pitta will be very high. He'll be
Okay.
hungry. So 4 hours he is awake and he has not had anything since morning, so he'll be awake. So when you will check, he'll be, his pitta will be very high, he'll be hungry. So at 10 o'clock when you will check his nadi, his pitta will be very high. So
Okay.
you will feel that pitta is because of his vikriti, but that is because he's hungry, he's not had anything since 4 hours. So that should be measured, that if he's waking up at 6 o'clock, maybe probably between 8:39 he should come and get his nadi checked. Otherwise, in emergency, Ayurveda says in emergency you can perform nadi pariksha, there's no issue. If a patient comes to you after 2:30, you cannot say no, I will not check nadi. But then you can make sure that patient sits comfortably, and all the external factors like wind, sunlight, or running, and everything should be avoided. Then second thing is, so what we have got from this is, we should always check for a resting pulse. Patient should be rested and then the pulse should be checked. So when we are checking pulse, agre vata, madhye pitta, ante kapha. That should always be remembered, because when not now, but when you practice for few months or something, and then when you go for an advanced nadi pariksha, this thing, in that, later on we learn that each finger also has vata, pitta, and kapha.
Okay.
So one finger denotes vata, one pitta, one kapha, but in each finger vata, pitta, kapha is also divided.
Yes,
So
yes.
when you go deeper into the dhatu nadi parikshan and organ wala parikshan, when you scan for organs and scan for dhatu, that time this should always be remembered that agre vata, madhye pitta and ante kapha. So agre vata means distally it is vata, madhye pitta is in the middle it is pitta, and ante kapha means at the end it is kapha.
Kapha.
And basically right hand for male and left hand for female. And now when we check Nadi, yours was 89 beats per minute, right? What was your rate? 89. So write it somewhere. Vata, Pitta, and Kapha. So Vata is 80 to 95. This is general. It could be up and down, but generally it is the case. So when it is 90 to 80 to 95, it is Vata. When it is 70 to 80, it is Pitta, and when it is 50 to 60, it is Kapha. Huh. So because vata in itself, in its nature, it is chalaguna, it is moving, it is light. So whenever you will check a vata nadi, it will be very fast, lot
Yes.
of very fast beating, and it will be very much like it could be 90, 95 also, like that. And pitta person are not very calm also, not very excited also, so their beatings will be in between. And
Medium.
kapha has a property of slow, snigdhita, heaviness. So it will be very slow. You'll feel the pulse. It will feel like very aram se it is going on, like that. So rate signifies that. So basically we have covered one portion, that is vega, nadi vega. So nadi vega, vat pitta fine, and then make a chart like nadi, how many vegas are there, so you count it and write. Then what rhythm do you feel, what, like all those things you will find out. Okay, next point we'll go on to tal. Tal is rhythm. Okay, so what is rhythm? How, what do you understand by rhythm?
Beating is the regular or irregular rhythm.
Regular. So like, what we say, in music we say, no, he's singing in rhythm, like that we say. So what that rhythm means is the time interval between two consecutive shifts. So when you hold your pulse, you feel one beat,
Up and
and then
downs.
so you feel one beat and then you feel another beat. So the gap between this beat and this beat, if it's just for understanding, say it is for 2 seconds. So one
Okay.
beat comes, and after 2 seconds, second beat comes. So then third beat also comes after 2 seconds. Then fourth beat also comes after 2 seconds. That is a rhythmic nadi.
Okay.
So the
Okay.
rhythm is very regular. We say regular rhythm. So it is coming very regularly. So it is a regular rhythm. So when you see a vata nadi, in vata nadi it is irregular rhythm. So you will not be able to find a pattern. There will be no
Okay.
pattern. It will be tuck, 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 then one beat skip ho gayi, then tuck, 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 like that. Okay.
Okay.
So this is what rhythm is. So now I'll give you an example. So if there is a case of premature ventricle systole, how will you find that? So imagine that when you are checking a person's nadi, you checked one, you got three beats, one, two, three, three beat you got, and then fourth beat is very, so first beat was very heavy, second was heavy, third was heavy, and fourth this much. So what is beat? Beat is the contraction, right? So when your heart pumps the blood out of it, it contracts and pushes out the blood. So that is the rhythm you find in the nadi. So one was fine, second was fine, third was fine, fourth was little bit. So fourth was little bit, matlab it is because of premature ventricular ejection systole. So ventricle could not compress completely, it compressed a little bit, so it gave a little bit of beat, not a full matured beat. So what it can show, it could be because of ablamba kapha also, it could be because of kapha also, because whenever kapha stops vata or pitta, it makes its speed slow and the force slow. So if it because of kapha, it can lead to, what you can imagine is, it can lead to hypothyroidism. So maybe patient has hypothyroidism, he has thyroid issues, that's why his beat is like that, because his, because three beats were proper, that means his heart has capacity to beat, but the fourth beat was not mature. It was premature. So premature means kapha is blocking it, and kapha is blocking it. Matlab, or how will kapha block it? Because kapha does not have its own motion ka way. So vayu vata gives it motion. So all the things could correlate to that he could have hypothyroidism. So this is how we'll interpret ki okay, this by this we'll interpret ki he has this issue, he has this issue. Later on we'll study about ama also, ama's nadi. So how do you get to know that the nadi which you're feeling the patient has ama in his body? You know what ama is, right?
I don't know, ma'am. Ama. What, ma'am? Ama is?
Okay, so the later on when I'll teach you that, I'll explain completely. Okay, so right now we don't need it. So you understood rhythm, Nadi Vega, rate you understood. And
I
second
understand.
thing is rhythm. Rhythm you
Yes.
understood. So now check for yourself and okay, then in Vat it is irregular, in Pitta it is regular, and in Kapha it is very regular. It will feel like not even a millisecond ka difference is there. So Pitta is very regular. Kapha is very regular. So now once you check your Nadi for 1 minute, now don't count it. Just see if it's regular or irregular. Okay, once you're done, just say hi. I'm just offing the mic and camera. Just see, note it. See if you take 2 minutes also, that is fine. But clearly you see that if it's regular, if how is it going, and if you need a pen or paper, you can draw it also if you want. Like this is going, then it was slow, then it was fast, like that. So I need if it's regular or not regular. Okay. Okay, I think Zoom meeting might end now because it is 45 minutes, right? It's gonna end now. So, how did you feel? You just tell me that, and we'll finish the class. Rest we'll take on next class.
Okay, just a minute.
So, and try to check for 4, 5, how many
Yes,
ever people you get. Huh.
this type, ma'am.
Okay. So after 1, 2, 3, 4, 5 beat, it was a low beat, and after every 5 beat it was a low beat.
Yes, ma'am. 5 or 6
Okay.
or
So
7.
it was okay. So it
What?
was irregular.
Yes,
It
ma'am.
was irregular, right? So irregular means it was Vatic kind, Vataja type. Okay. So now what I want is I want you to meet how many ever people you want, like in your house, and if your friends are there or whatever, and then your patients are there. Do check their nadi, okay? Do check their nadi and count. See only two things. Don't see Vata Pitta Kapha, nothing. You only have to see rate, the Vega, and rhythm. Only two things you see, and just keep a record that I've seen this person, this was, and with the drawing, you make that image also. Okay, so you remember the image and you'll be like, okay, this is there. And then for max, you see it for if you can see it for 10 people. Okay,
Okay.
so you'll see that for 10 people, and then tomorrow we'll go to next volume and tension and everything. Okay, so we'll keep comparing, and you keep practicing whatever two points karke we'll learn, and that you keep comparing so that you have when we'll go on to gati, right? So sarpa gati, manduk gati, hams gati, this will only come after practice.
Okay.
Until and unless you see some 50 patients with your own hand, you will not be able to differentiate between the gati, sarpagati, mandukagati, hamsagati, all those things. So later on in the later classes we'll take these things, and then we'll see.
Okay.
Okay. Okay, so now we have taken Vega and I have taken Nadi. So now what else is left? One Akriti is left. So in Akriti, two things come. And then Gati will come, then Bala will come. Okay, so we'll see that. So okay, we'll end this class now.
Okay, thank you, ma'am.
Can you hear me?
What, ma'am?
Ha, you can hear me, right? It was stuck. So I thought,
Okay, network.
okay. Hmm. Okay. So we'll go on to next, or we'll stop the class now. I think it is going to end now. Okay, then we'll see. We'll take this in the next class. Okay. Now you practice these two things.